let me talk about the parental medication. There are two keywords. One is parental nutrition and this parental medication. So parental refer to the path by which the medication or nutrition comes in contact with the body. Parental medication enter the body by injection through the tissue and circulatory system. And parental medication can be effective and safe when we prepare and administer correctly. So what they said, let me read it. Parental always means injectable or parental route, it including intravenous, intramuscular, intradermal, or subcutaneous route. Like the picture here, we can see this is the 3 layers of the skin. Most superficial epidermis, then second layer is called dermis. Together is called cutaneous tissue or skin. Subcutaneous tissue and muscle layer. So if the injectable form, intramuscular, you see in the first picture, 90° up to the muscle layer. Subcutaneous, like insulin, heparin, our target to this layer, subcutaneous tissue layer. And intradermal, it is in between dermis and epidermis, right? So this is the different kind of route we use in case of parental medication. Parental medication are packaged in a single-use ampoule or single or multiple use rubber vial. You can see there are picture, this is vial, right? And this is the ampoule. Usually ampoule we can use for single times. Vial we can use for multiple times. It depends. Now go here. The nurse should not administer more than 3 ml per intramuscular injection. So if you see doctor prescribed the doses more than 3 ml, it is good to hold, make a phone call, get a confirmation, then go next. Or 1 ml per subcutaneous injection site. Larger volume are difficult for an injection site to absorb. So if we see, we must need to verify. Next here, the when with the different route we use for medication, we call parental medication. But if we use different route for nutrition, it is parental nutrition, like central pathway and peripheral pathway. The central one is called total parental nutrition or TPN, and this one is called peripheral parental nutrition or PPN. The same picture, This line is subclavian or central line. Total parental or peripheral nutrition, we use central line. Sometimes the line we use for medication. Here we are going to focus on medication portion. As I told you, parental, it does mean it is a pathway by which medication comes in contact with the body. And parental medication enter the body by injectable through the tissue and circulatory system. And parental medication can be effective and safe when we prepare and administer correctly. So in this picture, you can see the first picture. This is the muscle layer, vastus lateralis site, preferred for the injectable site for pediatrics patient. NCLEX board asks question, which site or what muscle name is the best one for pediatrics injection? It is vastus lateralis. In this picture, we can see deltoid side, deltoid muscle, and this one is ventrogluteal site. And this picture also same. It is dorsogluteal site, and this is ventrogluteal site, and this is the deltoid. All of this site we use after age of 6. Before of 6 or pediatrics, we use vastus lateralis muscle. In this picture, it is showing subcutaneous injectable site. We use abdomen, both sides of the umbilicus. We use anterior aspect of thigh, and also we can use the scapular region, right? So this side, rotate the side to avoid the lipodystrophy. So if you give one day here, next day you can give the right side, alternative, left and right, to avoid the lipodystrophy. In this picture, we are showing 3 layers of the skin and the different route, different injection site and injection degree, like intradermal 10 to 15 degrees, the needle and surface. So in between dermis and epidermis, intradermal. Intramuscular, the needle is 90 degrees towards the muscle. And subcutaneous, in insulin, heparin, it is 45 degrees. And also, sometimes NCLEX board asks, in case of intramuscular injection, how many structure cut? It can cut epidermis, dermis, subcutaneous tissue up to the muscle layer. What else? Intradermal, they cut up to the dermis and epidermis. Subcu always target up to the layer of subcutaneous tissue. How many structures they cut? They cut epidermis, dermis, and get inside subcutaneous tissue. In this picture, we can see the length of needle 90 degrees, we call intramuscular, and needle size we usually use 1 to 1/2 inches needles. Whatever the gauge, 18 to 22 gauge. The subcutaneous, the needle, you see, inches, 1/2 to 5/8 inches, and gauge 25 to 27, and 15 degrees is intradermal as well. So next here, this picture showing the different parts of syringe. This one is called plunger, and this is the barrel and rubber support and tip of the syringe. And this one showing the marking, right? 5-meter syringe. Here showing the type of syringe tip, this one. Number 1 is called locker lock, and second one is called slip tip. So now go and discuss few NCLEX tips. They said the standard 3 ml syringe is used to measure the most injectable medication. 3 ml. It is calibrated in 1/10 of a milliliter. NCLEX note: always question and verify. If we see any dosage is excessively more or huge or very little in relation or contrast with patient age and body mass, it is we better to hold and contact to the healthcare provider. Now question, like you want to travel somewhere, it is difficult to carry the medication. That times we use like this, it is called dual chamber cartridge pen. Like you need insulin, you open up and put inside and then discard them. And this is called prefilled syringe. And this picture, prefilled needle medication cartridge, this is the metallic, but some are disposable. Prefilled syringe until dose cartridge with holder, also disposable or self-control systems. So question, what is prefilled medication cartridge? The medication cartridge slips into the cartridge holder, which is provide a plunger for injection of medication. Plunger, that portion. This is the plunger here. And also designed to provide sufficient capacity to allow for addition of second medication, which combined the doses are prescribed. The prefilled medication cartridge is to be used once and discard them. If the healthcare provider is to give less than full single dose, or if we provide that amount, he or she needs to discard the extra amount before giving the client the injection. Always read the instruction with commercial medication, also with purified or prefilled syringes to determine to remove the air from the syringe. Now, in general, the standard medication doses for adult are to be rounded to the nearest tenth of a meter or measure on a milliliter scale. For example, if it is 1.28 ml, is rounded 1.3. Why? The reason being 1.28. We said it should be rounded like 1.3. Like you are working in the midnight, you are sleeping. It can happen. You did not see this point, you ignored this point, then you can read it 128 ml. And this is huge number in relation to 1.28. Patient chance to medication toxicity, overdoses. But if you write full number, rounded figure, like 1.3, again, you are working the midnight, you are sleepy, you did not see, or there's so many patients, right? In emergency, you did not see. So if you do wrong, it should be 13, right? Better than 128. It is also overdose, but safer than 128. So when the volume of more than 3 ml are required, we always prefer to use 5 ml syringes may be used. So for the 3 ml medication, don't use the 3 ml syringe. Better to use the 5 ml syringe. What else? Now they said, in case of tuberculin syringe, hold a total capacity of 1 ml used to measure small or critical amount of medication such as allergen, extent, vaccine, or a child medication. It is calibrated in 100 of a milliliter with each 1/10 mark in a metric scale. So what we need to know from here for NCLEX board, the tuberculin syringe should be 1 cc. Capacity should be 1 ml. That's it. Here showing two pictures. One is tuberculin syringe, where showing total capacities 1 ml or 1 cc, and here 100 unit insulin syringe. So this is the unit. Sometimes we can see in the prescription, my patient need 3 unit insulin. Unit is the unit for insulin measurement. What next? Insulin syringe, the standard unit is 100 insulin syringe is used to measure the unit 100 insulin only. It is calibrated for a total of 100 units or 1 ml. Low-dose insulin syringe may be used when administering a small doses. What NCLEX note? We have to know insulin should not be measured in any other type of syringe. It is better to measure by insulin syringe. If the insulin prescription say that administer regular and NP insulin together, right? So if sometime we need to mixture the insulin, then what we could do, right? So regular insulin is a short-acting insulin. Sometimes we call homolog or novolin R. And NPH is the intermediate insulin. It is NPH stand for natural protamine hexadron. So if we need to mix two insulin, which one we should draw first? We could draw regular insulin into the insulin syringe first, then draw NP insulin or intermediate acting insulin. Short acting insulin or regular insulin first, then draw intermediate acting or NP insulin. Easy way to remember RN. You are waiting to sit for the exam NCLEX to get the RN license. R stand for registered and for nurses. R stand for regular insulin and N stand for NPH, natural protamine hexadron, or is intermediate acting insulin. Regular insulin first, then N, then draw intermediate or NPH insulin. And here showing two insulin, one is Novolog, right? And this one, Lantus. And Lantus, it is intermediate acting insulin. Sometimes long acting we call ultra lenta, or very long acting insulin, glargine we use. So this is two insulin. When we need to mixture, we should draw short acting insulin first. Then it is good to draw intermediate or NPH insulin next. Here insulin syringe, portable one, pen. So insulin is also administered using insulin pen with disposable needle that are usually pre-made before administering a dose. Each pen is used for an individual client. The dose is dilated into the pen, and many clients use this pen for administering insulin at home. The safety precursor we should follow, needle contain the device that are attached to the syringe and also slipped over the needle. And their use reduce the incidence of needle stick injuries. What next? So injectable medication. So whatever the different kind of route like subcutaneous, intradermal, or intramuscular, we need to put the medication. Some medication come to the powder form, we need to dilute them. And some medication in an ampoule, they're liquid, right? It depends upon their chemical nature. Some medication become unstable when stored in a solution form, or therefore they need to packaged in a powder form. And powder must be dissolved with a sterile dilutant before use. Usually sterile water or normal saline is used according to instruction from supplier of medication. The dissolved produce is called reconstitution. Now go and let me discuss a little bit more calculating the correct doses. So when we calculating dose of oral medication, always check the calculation, right? The question, the prescription, if the calculation call for more than 3 tablets. So the question arises, better to hold and confirmation first. When calculating the dose of parenteral medication, check the calculation, question of the prescription, if the amount to be given is too large or too small. Be sure that all measures are in the same system, right? So when you do a mathematical solution for the patient for dose calculation, the first priority conversion of the unit from large to small or same unit. So round standard unit injection doses to the 10th and measure 3 ml syringe. And also we should follow agency policies. Now continue. The round small critical or children dose is very important to calculate because they chance to develop the toxicity in case of critical patient, elderly patient, and pediatrics patient. And as we told, 1 ml syringe we could use for tuberculin. In addition to using standard formula, calculation can be done with dimensional analysis. The required elements of dimension analysis equation include the desired answer unit, conversion formula that is include the desired answer unit, right, and unit that must be converted, and the original factors to convert, including the quantity and unit. So here showing calculating a correct dose, the standard formula for calculating a medication doses. So D for desire, A for available, and Q for quantity. So as I want to give an example, D for desire, A for available, quantity or amount, right? So easy way to remember how much number of the tablet means quantity we need for the patient, number of the tablet or quantity equal to the desired dose divided by the medication in our hand available. So like doctor prescribed 500 milligram acetaminophen, right? And acetaminophen, 1 tablet contain 250. So 2 tablet or 1 tablet contain 250 means medication available in pharmacy, one tablet 250. Doctor prescribed 500 tablet. So if you divided the amount you have and desirable amount, you can get 2, and this is a 2 tablet you need. So this is called desirable formula calculation. The number of the tablet or quantity of the tablet equal to doctor's order or desirable doses divided by the medication in our hand or pharmacist provide medication. And now, next here, formula for intravenous calculation. Formula for IV, intravenous. We call flow rate, FR. Flow rate equal to total number of drop factors divided by time in minutes and multiply drops per minute. Infusion time formula, total volume to infuse, how much need to infused, divided by milliliter per hour volume infusion and multiply infusion time. Flow rate formula, infusion time formula, right? And other one we used here, percentage solution and ratio solution. Let me read it. Percentage means express the number of grams of the medication per 100 ml of solution. For example, calcium gluconate 10% means 10 gram pure medication in 100 ml solution. We call 10% expression. Ratio, express the number of grams of the medication per total milliliter of solution. For example, epinephrine 1:1000 means 1 gram of pure epinephrine per 1000 ml of solution. Now, intravenous flow rate. Monitor intravenous flow rate frequently, even if the IV solution is being administered through an electronic infusion device. Like nowadays, we use electronic infusion device look like this. In the hospital, we use this. It is easy to calculate the doses. If the IV is running behind the schedule, NCLEX board asks the question from here. Collaborate with healthcare provider to determine the client's ability to tolerate and increase the flow rate, particularly if the client has cardiac, pulmonary, renal, or neurological condition. So if patient has pulmonary, patient turns to fluid inside the lungs, or cardiac, patient turns to develop edema, renal, kidney, difficult to excrete the doses, right? It is very important. The nurse should never increase the rate of an IV infusion to catch up if the infusion is running behind. We never do this. Whenever the prescription of IV rate is increased, the nurse should monitor the client for increase the heart rate, increase respiration, or increase the lung congestion. We could monitor vital sign. We could monitor the lungs to check any fluid overload. NCLEX board frequently asking this question. Answer is check the lungs. Any added sound, it indicate lungs is full of what liquid congestion. IV fluid are most frequently prescribed on basis of milliliters per hour to be administered. The volume per hour prescribed is administered by adjusting the rate at which the IV infused. The most flow rate calculation involve changing the ml per hour into drops per minute. GTT, it is the abbreviation for drops. Electronic infusion device picture, you can see. And now formula. What is the formula we use to find out the flow rate? This formula is only applicable when the mathematical problem mentioning time by hour. If time mentioned in minute, we have to follow the different formula that we discussed a few minutes ago in the other pages. The flow rate ml per hour equal to volumes. Volumes mean total liquid, how much we need, and the duration of infusion, right? Volume to field being administered. Times means time for volume to be infused. So there are three figure. So if you get any two in the question, number 3-1, you can find it out just following this formula. We call medication formula IV infusion. This formula only applicable when mentioning the time in hour. But if formula mentioning the minute, we could better to follow other formulas like this: infusion times, or number of milliliter per hour, or flow rates, total volumes, multiply drop factors, and time in minutes, right?